Welcome back to MTP. This is 118, but we're going to be going back to 57. 57 has been probably the most referenced of all of our MTPs, and that's the one where we talk about our exercise, the exercise that we use here at Perito Urology with our approach. And that exercise, I didn't realize it bothered my daughters because I was holding this thing right here in the middle of my chest. And then I was doing this like I was pulling on a lawnmower. And that upset some people on Reddit. And they're like, how hard does Perito want us to pull this penis when we are exercising it? Let me explain to you where the concept of this exercise came from. In my office, there tended to be a trend for patients to come in about 4 months and say, "Hey, Paul, I'm losing power," and everyone that said they were losing power had one thing in common, and that was a partner who was riding them on top and riding them good. So when you ride somebody, right, that penis is going to do something like this. I'm not going to do that to my daughters again, but that concept was what gave us the idea to do this exercise. Because if you give a guy a few pumps after you have gently rocked that penis back and forth, then you're going to be able to increase your volume, your overall volume, which leads to what? Increases in length and girth, because each pump in the pump we use is 2.5 cubic centimeters. And I'm telling you, this can go on for a long period of time. So the advice, right, which this is for our patients, you need to talk to your urologist and they ask what they do. Some urologists tell you that they want you to have this thing pumped up for a couple hours. I think that's kind of sadistic because it can give you priapismic-like pain. But what we're doing takes minutes. It's very similar to the whole sexual act, which in general, from penetration to ejaculation, is about 10 minutes. So you shouldn't have to be putting a ton of time in to make sure you maintain those tissues and expand them and allow for adequate tissue expansion. So what do we got to do? Okay, I'm going to bring this thing back out again. You pump your implant all the way up. Let's make sure this is not a revision. And if in our case, we start this at 2 weeks, other people might start cycling it 3 or 4 or 5 weeks. But for our virgin cases, it's 2 weeks. So you pump that penis all the way up. Once you get it all the way up, then you hold the base of the penis with one hand, and the other hand you gently rock back and forth, up and down. And actually, a mechanical engineer patient of mine said if you rock it gently and slowly stop and wait, you're going to get more expansion, especially with polyurethane. But once you've done that, then you reach down, you give it a couple more pumps. Or if you got that partner riding you, you reach down, give them a few more pumps, and then give them a kiss. So it's easy, it's safe. Let's not treat it like a lawnmower. These are gentle movements. Let's not get anybody hurt either. See?